Nobody could believe it. When Dr. Now entered the operating room, the patient was so overweight that even the table couldn't hold him. But the truly shocking part was what happened just minutes later. It was 1:45 a.m. When the phone rang, Dr. Now was already exhausted. He had performed 4 surgeries during the day and spent hours seeing patients. But this call was different. "Doctor, it's urgent. We can't move the patient," said the nurse in panic. Dr. Now rushed to the hospital. What he saw inside took his breath away. The patient weighed 340 kilos. The stretcher couldn't support him. The nurses were out of breath. The man was so squeezed that he was struggling to breathe, his heart racing. If they didn't intervene within minutes, his heart would stop. But there was something Dr. Now didn't know yet, and at that very moment, everything changed. He directed the team toward the operating room. But there was an even bigger problem. The table couldn't hold the patient. The metal legs groaned, and the table suddenly collapsed. Everyone froze. The nurses screamed. "How are we going to do this?" whispered the anesthesiologist, trembling. But Dr. Now was determined. "We have to save him. If the table is broken, then we'll be the table." The team gathered around the collapsed bed. Everyone supported it with their shoulders, placing stools underneath. Time was running out. The patient was starting to close his eyes. Dr. Now took a deep breath and made the first incision. But just then, the door opened. The chief surgeon entered. "Stop this surgery immediately. The risk is too high," he shouted. Dr. Now clenched his teeth. "If we stop, this man will die," he said. But the truly shocking part was just minutes away. "Wait a minute. Don't miss this detail." During the surgery, the anesthesia monitor began to malfunction. The weight had pulled the cables loose. It was now impossible to measure the patient's pulse. "Doctor, we can't see his heart rate," the nurse cried in fear. Dr. Now placed his hands on the patient's chest. The heart was slowing down. "I can feel it in my hand, but it's fading." Just then, the phone rang. Another critical call came from the ICU, but Dr. Now knew if he left this table, this patient would die. Dr. Now discovered that the spleen was torn. There was massive bleeding, but worse, the patient could no longer breathe. "Doctor, oxygen is dropping," the technician shouted. Because of the obesity, the lungs were compressed. Dr. Now was left with 2 deadly choices. If he didn't stop the bleeding, the patient would die. If he didn't restore breathing, the patient would still die. Time was now measured in seconds. "You haven't seen the biggest surprise yet," the chief surgeon barged in again. "End this surgery right now," he ordered. Dr. Now shouted back in anger. "If I transfer him, he'll die on the way. Think about rules." "But I'm thinking about his life." Just then, the patient's heart stopped. "Defibrillator," yelled Dr. Now. The team froze, but Dr. Now stayed calm. 1, 2, 3. He shocked the patient. The chest lifted, but the heart didn't. "One more time," shouted Dr. Now. And at that moment, the monitor beeped. The heart was beating again. 20 minutes later, Dr. Now stopped the bleeding, but the patient was still in danger. The team was exhausted. "Doctor, can we really do this?" whispered the nurse. Dr. Now closed his eyes, then opened them with determination. "We have to, but what you've seen so far is nothing. What you've seen so far is nothing." Just as things started to stabilize, the oxygen tank began to run out. A new tank wasn't ready. "Doctor, we only have 5 minutes left," said the technician. Sweat dripped from Dr. Now's forehead. "Give him manual breaths until the new tank arrives," he ordered. The nurse grabbed the mask and began pumping air manually into the patient. Minutes felt like hours. Finally, the new tank arrived. The patient was saved. But the real shock would come the next day. The following morning, Dr. Now was called to hospital management. "You broke the rules. You acted outside protocol," they said. Dr. Now stayed silent for a moment. Then he spoke slowly. "That man is alive. His family is crying with relief outside. That may be a problem for you, but for me, it's a success." The chief surgeon slammed the desk. "I will report you," he shouted. But Dr. Now didn't care, because the patient's family was about to enter. "You won't believe this." The patient's family rushed in. They cried and held Dr. Now's hands tightly. "Doctor, if it weren't for you," he said. Everyone went silent. Tears filled Dr. Now's eyes. The biggest surprise would appear weeks later.
The patient recovered quickly. Not only did he walk again, but he also began losing weight. Dr. Now gave him a special nutrition plan. Turmeric for inflammation, fish and lentils for protein, yogurt and kefir for gut health, oranges and kiwis for vitamin C. 3 months later, the patient even joined a walking race. But what he said at the finish line would turn Dr. Now's life upside down. Wait a minute. Don't miss this detail. On a television program, the patient hugged Dr. Now and said, "You brought me back from death, but there's something you don't know. That night, the reason the table broke, I know why." Dr. Now froze. The patient spoke of something he had seen in his own room. It wasn't an accident. It was sabotage. This was no longer just a surgery. It was a conspiracy. The patient whispered slowly. Doctor, that night, the bolts on the table had been loosened. Dr. Now's heart raced. But who and why? Everyone thought the truth had been revealed. But the most shocking part was that this story was far from over.